Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 7 signs and symptoms of iodine deficiency. But before I do that, I will go over the relationship between iodine, the thyroid gland, and the relationship between iodine and the mitochondria. So it will make a lot of sense why you might have those signs and symptoms. And we're going to go over several studies to confirm the popularity of those signs and symptoms with a lot of patients. And at the end of the video, I will cover what you should do at home if you have iodine deficiency. So first, the relationship between iodine and the thyroid gland. So quickly, the thyroid gland is actually maintain all your organs function. So it's located here in the neck. You can see it here. The purple look like a butterfly, and it's responsible for your metabolism, your body temperature, your heart rate, your blood pressure, your cell production, your growth, your development. And the thyroid gland, very important because it produces the thyroid hormones that help your body to convert carbs and protein to energy. So it's help regulate your growth or help for development. So the main hormones for the thyroid gland are T4, T3, and calcitonin. I will focus on T4 and T3 because that will help us to understand how important iodine in relationship to the thyroid gland and thyroid hormones. So T4 is actually 4 atoms of iodine, and T3 is actually 3 atoms of iodine. So your body take the iodine that you get it from food. Your body does not produce iodine, and bind it to trypsin, and that's actually form the T4 hormone. And then your thyroid gland is actually deiodinize the T4, which take one of the iodine atom from the T4 to produce the T3, and the T3 is actually the active form that 80% to 90% of your body utilize for metabolism, for the function of all your body. Why T3 is extremely important? Because when you think about your body is like a battery. If you are running low on T3, the thyroid hormone, it's like you're running on 5% of your battery. So you're barely gonna make phone calls. You will not be able to use a lot of apps because everything is slow. That's exactly what happens when you have low thyroid hormones. Your metabolism is gonna be low. You're gonna gain weight. Your brain function will be poor. You will have foggy memory. You will feel tired, fatigue, cold hand and feet. And that's because you don't have enough nutrients or the iodine that's actually building block for the T3. That's what's significant for the iodine to be as an important part of our diet, because if it's not included in our diet, there's a higher chance you have iodine deficiency. So the other thing I want to cover is the relationship between iodine and the mitochondria. So mitochondria is organelle that's actually in all of our cells. We need to have that. It's kind of powerhouse. It's like the engine in your car. That's the mitochondria. We need the mitochondria because it's actually producing 90% of the energy in the cells. It's extremely important. And to show you the importance of mitochondria, we have more mitochondria in the cells that require more action or more activity throughout the day. For example, most of our concentration of heavy mitochondria in the cells in the heart, because you need your heart to pump 24 hours a day, 7 days a week for the rest of your life to stay alive. And the second great amount of mitochondria is actually in the brain to help with the brain function. So it runs between 200 to 10,000 of mitochondria per cell. So you're probably going to find the 10,000 in the heart cells and closer to that number in the brain. So why mitochondria is important? Because it's the engine that's actually make the car running. So let's look at the relationship between the mitochondria and the thyroid hormone. So before we do that, mitochondria is actually converting the nutrients that you get it from food to break it down to turn it to ATP, and that's the main source of energy for the cells. So that's the main function for mitochondria, to take your gas and create energy as happen in the car engine. Okay, so the first sign, and that's related to the mitochondria, is tired and fatigue. Why? Because you need the iodine to produce the T3, and actually you need the T3, the thyroid hormone, so your mitochondria can work properly. So the mitochondria dependent on the thyroid hormone, especially the T3. So it's actually the iodine increase your thyroid hormone levels, and that will help to increase your red blood cells and also increase the oxygen level, which actually increase the mitochondria size. So that's the indirect relationship to the mitochondria. So if your thyroid hormone is low, and that's because your iodine is low, your mitochondria will not function properly, and you're going to feel tired and fatigued throughout your body. So the second sign of iodine deficiency is depression. And I personally experienced that after my second cancer treatment. I was very low in iodine, and unfortunately the doctors I worked with, no one will test for iodine deficiency. And after I did my own test and figure out why I have the deficiency, and I start with supplementation, I start to feel better, and I start to have more energy, feeling better overall. So in this study, they looked at low selenium and iodine. They found the relationship between that and actually depression. And they found that when they provide iodine supplementation, that the patient anxiety and depression has been decreased. And here is a link for the study. So, the other thing that's very common with iodine deficiency is called hands and feet, and that's in very close relationship to the thyroid hormone, because your thyroid hormone is actually regulate your body temperature. So if your T3 is low, it's not gonna regulate your body temperature, and you're gonna feel cold hand and feet. So the fourth cause of or symptoms of iodine deficiency is brain fog and poor memory. And they found in the study information processing, fine motor skills, and visual problem solving are improved with iodine replacement, actually, in the students and school children. So when they gave the kids iodine supplementation, their memory improved, their fine motor skills actually also improved, and that's also confirming the relationship between the iodine and the thyroid gland and the development and the growth, and also the relationship between it and the mitochondria, that you have a lot of mitochondria in the brain, but if you don't have enough iodine to produce enough thyroid hormone, your mitochondria will not work properly, which your brain function will be affected indirectly. So the fifth signs and symptom is weight gain. Why? Because, as I mentioned, iodine is extremely important for the thyroid hormone, and the thyroid hormone is actually regulate your metabolism, which means converting food to energy. So if you don't have enough iodine in your system or enough thyroid hormones, your body is not going to convert food to energy. It will it will turn to fat, and you will gain weight, and that's the other relationship to weight gain. The sixth reason is compromise your immune system. So let's look what this study said. Iodine is essential required for the function of all organs. We already know that. So they found that it enhanced the immune system, improved trafficking, which is actually the movement of the white blood cells in your system, and then the iodine help with clearance of infection. So when you have infection, you need to clear those infected cells or kill them. And actually, I'm gonna go over this in another video, the mechanism how iodine kill or destroy infection like viruses or bacteria, and also how iodine can destroy cancer cells. I will go over that in other video. So it supports processing of reproduction, because when you have infection, you need a lot of white blood cells. You need a lot of like natural killer cells to destroy the viruses or the microbes or the viruses or the cancer cells. So your body actually deplete a lot of these and need a lot of production of those white blood cells to fight those infection a pathogen. And one of the function of the iodine is actually help your body to produce more of those white cells that will fight the pathogenic cells or pathogenic objects. So the last reason, and that's very personal to me because I'm a cancer survivor twice, it's actually they found when they looked at women with the breast cancer, they found there is absence of iodine in the cancer cells, absence or low, very low iodine. And they found the iodine required by the memory cells, the tissue, for normal function, and that could increase your risk of having breast cancer, thyroid cancer, or other different type of cancer. As I said, we'll go over the mechanism of iodine and how it can destroy cancer cells in other video. So let's sum it up. When you have iodine deficiency, that will decrease your thyroid hormone, especially the T3, that you need it for metabolism, and that will lower your metabolism, which means you lower your energy level, so you're gonna have you will feel tired, fatigue, and also it will increase your weight. The other issue with iodine deficiency is it's decrease the mitochondria function, and also that indirectly will cause your energy to be low, your memory will be poor, and lastly, it affects your immune system. When your iodine is low, your immune system is compromised, and that's increase your risk of cancer and infection like viruses or bacteria. So what should you do if you have combination of these? If you have combination of these, there's high chance you have iodine deficiency. I have another video. I answer why I have iodine deficiency, because I go over the diet. If you not having certain food in your diet, there is a very high chance you have iodine deficiency. Iodinized salt is evaporating. That's not a good source of iodine. So feel free to check that other video in my YouTube channel. But you need to understand that in healthy body, there's 13 vitamins, 16 minerals. There's over 50 hormones and 40 neurotransmitters. And when you have deficiency in any vitamins or minerals, that's indicative of imbalance in your system. And also, it's never, from my personal experience after my cancer treatment and from my personal experience with treating patient, I never seen a patient that has one deficiency only. It's very common when you start to have symptoms like cancer or compromised immune system, weight gain, foggy memory, or depression, or tired and fatigue. It's extremely common that you have combination of vitamins, mineral deficiency, sometimes hormonal imbalance. So the only way to figure out why you have those symptoms, because a lot of these symptoms overlap with a lot of several vitamins and minerals, we have to do a proper evaluation to figure it out. So how to treat iodine deficiency? One of the things we need to know how much iodine you need, and to do that we have to look at the lab. The lab is not very sensitive, so we have to really look very carefully when we interpret the lab, because we have to look at the iodine level, the thyroid levels, and other vitamins and mineral levels simultaneously. So I usually recommend iodine supplementation. You have to take it with other mineral, because if you don't, the iodine going to be toxic to the cells, and I will go over that in other videos. Dosage extremely important, especially if you have deficiency. If you need 100 milligram of iodine, that's for example, and you take in supplement that has 5 milligram, that's way low than what your body needs. You're not gonna feel any difference. It's not gonna make any difference to your symptoms. So dosage is extremely important. That's why we have to really look at your lab and be very specific about the dosage in relationship to what deficiency you might have. Forms, there are several forms of iodine. There's ones that are actually toxic to the cells. I don't recommend it to patients, so we'll go over that in other videos. But one of the things you can do actually right now is take advantage of Ask ASTR. It's a free online medical evaluation. The software, it takes about 5 minutes, and the software will guide you through possibility of vitamins, mineral deficiency, and what kind of steps you need to take to really figure out the main root cause of the symptoms you are experiencing. So if you have any question, leave it in the comment section below, and I will answer it in a future video, and I will see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.